I'm the circulating nurse, and what that means is instead of helping with the instruments with the doctor scrubbed in on the sterile field, instead I'm kind of like the patient's advocate during the procedure. I make sure that we're doing everything we can to make sure she's safe, and try to help coordinate everything, help with prep and positioning, make sure everybody knows about allergies that she may have, and make sure we're all careful with that, make sure we're doing the right procedure, help with getting any kind of supplies they need, and I also chart the entire procedure so there's a record.
The anesthesia portion will be general anesthesia. We'll bring the patient into the room. We'll hook them up to our monitors, which are our heart monitor, our respiratory monitor. We'll monitor blood pressure, all their vital signs. We'll give them oxygen to breathe for a little bit before we induce anesthesia. And we'll give medicine through their IV that they've already had in place, and which will put them off to sleep. And then we'll put in a breathing device in, and then we'll run anesthesia gases, which are these here, to the ventilator tube to their lungs that keeps them asleep for surgery.
A physician assistant is a healthcare professional. We're a provider of medicine. We operate and perform histories and physical examinations. We write prescriptions and treatment plans for patients under the supervision of physicians.
I prepare the instruments and make sure everything works and we have everything. We open the sterile field and put all our instruments out, and I get them ready. And then when the doctor comes in, I'll help him drape and get all the trocars placed and put the camera in. And when he needs instruments changed, I'll change the instruments and help him while he's over there actually doing the surgery. I'm with the patient.
I went to Trident Tech in North Charleston for 2 years to get my associate degree in nursing, and am presently enrolled in a RN First Assist program with a school out in Nevada, so that I can be a First Assist here with the robot, and gonna start my bachelor's next year. So
The OR is really fun, especially if you get to work as the scrub. As a nurse, you can either scrub or circulate, and when you scrub, you really get to be in there with the action. You're handing instruments to the doctor, and you can be in some intense situations, but you feel like you're really doing some good. It's a rush. It's fun.
Right now, this is the camera that will actually be placed in the patient. So we need to make it sterile, the cords, and so this will go on the camera.
I really enjoy the operating room. When I became a nurse originally, I started out on the floor upstairs. Was fortunate enough to come down and follow my patient down for surgery as part of my orientation, and thought, that's really cool. You make a difference upstairs, but this is another world. Actually getting to see that gallbladder come out, or in our case today, the uterus come out, and know that that patient's going home and they're gonna feel better, and you had a direct part in that.
Robotic surgery allows you you can see a lot better. There's laparoscopic surgery where they have little trocars and long instruments, but you can't see as well. You'll see on a monitor like this, but with the robot, the doctor can have 3D vision, and he can see inside the body a whole lot better. And his instruments, he has a lot better control than what we would for a basic laparoscopic case. It's like the next level up.
To me, the technology is awesome. To think that we could have done this procedure for us here at Trident less than 2 years ago maybe, and the patient's here for several days. They have big incisions across their abdomen. They come in today, they get a couple little portholes, we accomplish the same procedure, and they go home that afternoon, back to their normal life, back to work possibly, depending on what they do. It's great.
The most interesting thing about my job is really the patient their life is in our hands. It seems easy from a glance, but it's a very dangerous and very skillful job where things can change in a second. You can have good outcomes and bad outcomes, and you have to really stay vigilant and stay on your toes.
There's less operating that I get to do in the robotic surgery, which is actually really, really good for the patient, in the respect that there's not a lot of open wounds, etc., that need to be sutured and closed at the end of the procedure. It's really a couple of small portals with a couple of single sutures, and we're done. which makes the recovery significantly less for the patient. So it's less work for me in that regard, but it's better for the patient.
Blood loss is a lot less. You know, with a regular open case, you could lose 300 or 400 cc's of blood, and with the robot, maybe 100, sometimes less than 50, so it's a lot less.
The kind of person who does really well in the OR is somebody who is flexible, somebody who gets along well with people, because you're dealing with a variety of people. This is definitely a team approach to taking care of the patient. And somebody who has stamina, because sometimes the procedures can be lengthy depending on the type of procedure. And somebody who loves medicine and loves taking care of people.
The OR scene is different from any other, unit in the hospital. It's very strategic. There's a great team down here, team effort. Everybody works together, and not one person can do the surgery. It takes, a team of 5 or 6 people to get the task done, and that's what I like about it.
You get to basically wear your pajamas to work. It's, there's tense times, but it's also relaxed. If you're looking for something that's exciting, this is a fun place to be.